Welcome, everyone, and thanks so much for joining us on the Flourishing Life Podcast, where we will be discussing what we see on the daily. We're Jackie and Tad from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tewes and is not intended to diagnose or treat any medical conditions. Be sure to speak to your healthcare provider for your unique health needs. Welcome back, everyone, to the Flourishing Life Podcast. Jackie here from Flourish Medical and Wellness. We're listening to you. Our patients is our priority and practicing a team approach to foundational wellness for long-term healing. I am beyond thrilled and excited to have Dr. Tabatha with me today. I've had the privilege of getting to know her beautiful heart and soul and just beautiful human through one of our mutual networks. And so excited for you guys to get to know her. I would love for you to just start with telling us who you are, what do you do, and maybe even if you're get into the story of kind of how you got to where you are now.
Oh my gosh, thank you for having me. It's such an honor, and I know that there are going to be people who are blessed by this conversation, so I'm really excited to have it. The truth of it is, I did not expect to be a doctor, women's health expert, or any of that. I was a wild child. I lived in Saturday school and detention. I wanted to be a rock star and marry Tommy Lee. Thank goodness God doesn't give you all that you pray for, right? That wild life ended me up getting pregnant in 11th grade, and I had to go on food stamps and Medicaid. A doctor was assigned to me, and he made it clear to me that he was getting 22 cents on the dollar to take care of me. So the truth of it is, a lot of things were done to me, procedures, invasive exams, a lot of medications given, and there was no conversation. There was no informed consent. I really didn't know why things were happening. And after a very long and drawn out traumatic delivery with a 4th-degree tear, women who have had babies are cringing right now because it's the worst of the worst. I just remember laying in that room, him stitching me up for a good hour, looking at my daughter in the warmer and thinking, please God, don't ever let any of this ever happen to her. This is just too much. I can't even take it. And God started to whisper to me, and it was one of those come to Jesus moments of you should never let that happen to her, but you shouldn't let this happen to any women. This is not okay, and you need to learn how to use your voice and speak up. And that just instilled this fire in me. And of course, I didn't know what any of it meant. I'm a 17-year-old high school dropout, but God is just calling me to do this. And somehow I went back, I got my GED, I got into a community college, got scholarships, transferred to Michigan State, got into medical school, and did all of the things and found myself as a successful doctor and making a salary. I was getting a really good paycheck. From where I come from, I was rich. You know what I'm talking about? With the 401k and all the things, all the security, all the goodness that people in my life, that was what they wish they could have. And I was absolutely miserable. I was falling asleep at my desk. I couldn't remember the names of the patients I delivered the night before. I was 35 or 40 pounds heavier than I am right now. I had such bad eczema that my hands would bleed every single day. I had irritable bowel syndrome. I was on my 5th antidepressant because I was so depressed and miserable. And I was supposed to be a success story. You know what I mean?
Yeah.
But I wasn't. I was absolutely miserable. And here's the cool thing. I burnt myself out so bad that I even went through and had back surgery for herniated, ruptured discs. Tried to heal from that, came back, re-ruptured, and I couldn't move. And God put me on my back for 7 days. And he's like, can I have your attention now? Like, you did this without me. You left me in the delivery room. This is not what I actually called you to do. I didn't call you to like carry all this burden on yourself, by yourself. And that's why it's not sustainable. That's why you broke your back. And so as painful as my life has been, like it feels like a constant uphill battle and struggle, I am so grateful. I can finally read the book of James and call it all good for these trials and tribulations and say, I get it. You were trying to do a work in me. You were trying to show me that I'm supposed to do it with you and not just get my marching orders and go and do it without you. And so ever since that moment, everything in my life has shifted. I'm not even recognizable anymore.
That is incredible. And I literally have like whole body goosebumps, right? Because, when God shows up in those ways, it's so life changing. And that I would say is a similar story for me too. I was so drained in the traditional world and primary care and seeing all the people in 15, 20 minutes. And it was a lot of weight that was being carried. And so that's incredible. It's incredible that you recognize that, you might be a little stubborn, maybe, that he had to literally put you on your back to be like, all right, Tabatha, come on, let's get this straight here. So thank you so much for just being so open and vulnerable and sharing all of that. Tell us what you do now. So I know a little bit, but tell my audience, like how do you help women? So you were a traditional like OBGYN and then kind of shifted your practice. So tell us about that.
And not only did I deliver babies all night long, but I was a surgeon and I loved being a surgeon. I was a really good surgeon. I did advanced robotic surgery. So I did the stage 4 endometriosis that nobody in town would touch, and the huge fibroid removals and sacrocolpopexies, which are robotic procedures for uterine prolapse, vaginal prolapse. Like the people who nobody else would touch, I would be like, I can fix you. I can do this. God has blessed my hands. But here's the problem. I had an ego. I really thought I was the healer. I thought like, I'm the answer. I'm the solution. And when God sent me on this healing journey of figuring out that my back issues, my depression, my Hashimoto's, my irritable bowel, all of the things were from my poor life choices, my terrible diet, my all the emotional stuff I was ignoring. He started to reveal all of these things to me and show me like your body could actually heal and thrive and be amazing, but you keep destroying it. And so once your eyes are opened, you can't go back. And I realized like these women with stage 4 endometriosis, they had chronic gut issues that they needed healed. They had mold exposure that was building up in their body. They had trauma from childhood or current relationships that they weren't dealing with. And like the Mountain Dew they're bringing into their appointment and, drinking while they're telling me they work third shift. That's why you have endometriosis. And so God just like convicted me on the fact that I had to give up being a surgeon and show them there was a different way and that they could actually heal and reverse disease and thrive. And so I had to die to my old self because the tools I had from conventional medicine weren't actually healing people. It was just a lot of Band-Aid medicine. Like, yep, I removed your endometriosis for the moment, but you'll be back in a year and we'll do it again. So I still miss it. I miss it so much. It was really awesome being a surgeon, but it is so much more rewarding because I used to do 5 or 6 surgeries a week and now I do none, and I heal way more women doing this root cause healing.
That's amazing. And we have more overlap and similarities than I even realized, which is super cool. But this just came to me as you were talking. I think it's interesting how God has kind of pulled both of us out of that traditional world. And what he has led both of us and kind of opened our eyes to is that, hey, I need you to spend more time with people. I need you to educate people. I need you to love on people and be that extension. And I just think that's so, like, of course, that's God, right? Like, that's who he is. And that's what he calls us to do in that community and loving. And so I think that's awesome because it sounds like that's what you do for your patients as well.
Yeah, I mean, you know what it's like when you have 30 patients on your schedule, you get 7 to 10 minutes with them. And then you throw in an annual exam with that.
Yeah.
Like, I'm talking to you while I'm doing your pap smear and your breast exam. I used to give what we call naked hugs because, like, nobody had their clothes on when they were coming to see me, but I'm trying to talk to them about their marriage and their job that they're struggling with, and like trying to deal with all these deeper things in 7 to 10 minutes, and you just can't do it. And so I have been so grateful that God has given me the gift of time to sit down across, from on Zoom, but to listen to women's stories and look at the timeline of their entire life and help them connect the dots of like, when you had your appendix out at 7 and then you grew up on a farm with pesticides and then you went to college and got mono, this is why you can't function now at 43. This is why you can't get out of bed. And like nobody gives them that time and that space to just be heard and to be seen. And so I feel very honored for where I'm at right now in the work that I'm doing. And it's so needed.
That's amazing. Like we need 5,000 of us, I think. I don't know about you, but I'm always like, I need more of me to help more of you. But so is your practice primarily virtual?
Yeah, so we are all virtual, and I have a few providers who see patients with me. We have a health coach and a nutritionist who has a master's degree in functional nutrition, because I really feel like you need a team working on you. You really do. You need to be working on all aspects, mind, body, and spirit. And I've realized that I can't be all of those people for my patient. That doesn't help me. It doesn't help them. And so it's been really beautiful watching my team step into their callings and what they're gifted at and helping women have breakthroughs. It's been super rewarding. But you mentioned the fact that we need to clone us. Like, I wish there were more of us. And that is really what God downloaded when he put Fast to Faith on my heart. He was like, you need to help women do what you're doing by helping other women. And so we've created this Fast to Faith Coaching Academy where I train the foundational aspects of functional medicine for coaches so that when a woman comes to them and connecting all the dots and not functioning from just a silo. And so that's been really amazing to see me impart all the knowledge and wisdom that I've gained through all my pain into my coaches, and now they're going out and they're helping other women. So I'm seeing this beautiful ripple effect, and I'm not doing all the work. And that's the cool thing. Like, it's sustainable for me. I'm not going to burn myself out because I am just empowering women to help other women. You know what I mean? So that's been really rewarding. And the medical practice piece has been an issue. It's like, I still want to help women through all that root cause healing, but Fast to Faith is where God has been calling me. And so I've kind of been trying to discern, like, what does the future hold? And my team and I keep coming up with, we're going to keep moving forward and doing our last thing that God told us until he reveals the next thing or opens the next door or closes the next door. So that's why I love connecting with women like you who are doing all of this root cause healing work, because God's telling me that I'm on to this, new thing of fast to faith, and I can't continue to see patients. And it's like, oh, you already told me to quit giving up my surgery. Now you're telling me to give up seeing patients one-on-one.
Yeah.
But I just have to trust that he's making a way, and it's all for my good and his glory. You know what I mean?
That's amazing. And you know what I love so much about this is that, especially, no offense, right? Because I'm a nurse practitioner, you're a doctor, but I do feel like most of our doctors are very hesitant to coach up coaches or to even work with coaches.
Absolutely.
So it is amazing and so incredible that you're like, no, I am not better than you. I'm going to train you and I'm going to teach you how we work together, because that's the sweet spot, right? Like what we do, I always tell my patients, I'm not against traditional medicine. I'm not like, I want to work with them. I think if we can really treat the whole person well, we're working as a team. And so that is amazing to me that even as, a certified medical doctor, you say, hey, I'm going to teach those coaches how to be really, really good. And we're going to collaborate. It's not this, well, they're just coaches. They don't know what they're talking about. That is incredible. I love that.
Oh my gosh. Can I speak to that a little more? Because having gone through so much pain and struggle in my life, I just see it as such a gift. And what I keep seeing more and more of is like people who have conquered some things, they have authority over it now. They can stand on top of their story and go out and help other people. It's like this pain to purpose movement. And so I have coaches who have conquered, being an alcoholic, and they are living an amazing life sober. I have coaches who have conquered SIBO and chronic lifelong gut issues, and now they are thriving, or they've lost 100 pounds. They all have their thing. And so they can speak to it so much better than I can because they went through it. And so they're like the perfect guide for so many women. And it feels really good for me to shine the spotlight or let them shine their light and help other women. God keeps dying me off more and more. He's like, no, less of you, more of me. Yeah. And that has really helped me just raise up other women. And so it's been really cool to see these coaches help other women through the things that they thought were going to take them out. And instead now they're like helping these other women with it. It's so powerful.
That is incredible. And I love that pain to purpose. That's so good. Okay. So what would a patient working with you guys online, what would that look like? Kind of walk us through that a little bit.
So when women work with us in our medical program, and we have husbands who do it too, we have a signature program called Healthy Her. And what that looks like is we do stool testing, because I have seen that the majority of inflammation is coming from chronic gut issues that are just not diagnosed. So we look at the microbiome, we look at the digestive function, all the amazing things that you can see on stool testing. We also do food sensitivity testing, because what I've found over the years is that if you do not remove what is triggering and confusing the immune system while you're trying to heal the gut and get back into balance, it's just not going to happen. And so much of that is driving autoimmune processes and different things. So we do that. We do Dutch Plus testing. So we are looking at the metabolism of your sex hormones like estrogen, progesterone, testosterone, DHEA. But we're also looking at your 24-hour cortisol pattern, which is so important, especially in women, because we all wear this busy badge of honor. I'm so busy. I'm so busy. I'm just, I can't even think straight. And that is driving so much disease and dysfunction that we have to show women, here's what's actually happening with your adrenals and your nervous system. And we also do complete panels of blood work. We look at a full thyroid panel, not a conventional medicine panel, right? And so just taking that comprehensive approach and working with the functional nutritionist on the food piece and the coach for mindset renewal, we just have incredible transformations because we're like turning over every piece of the puzzle. There's no more guessing. You actually get to see what's going on completely. And women are so appreciative. Like, we find stuff that hasn't been uncovered in a decade or two, right? But I would be remiss if I didn't highlight the fact that in order to heal the body, you must first renew your mind. It all starts in your mind. It all starts with your thinking and with your beliefs. So if you're not tackling that piece and really uncovering the lies that keep you stuck, keep those bad habits coming back, that prevent you from changing, your choices and your behaviors, like, it's all going to be worth nothing. So you can spend $5,000 on a program, $10,000 on a program, work with someone for a year. But if you don't believe that you're worthy or capable of healing and having an amazing physique and being strong, and you don't believe you're going to sleep through the night, like, you literally just won't. That's the truth of it. Your mind drives all of it.
Yeah, so good. And one thing I love that you guys do, it sounds like, I think sometimes in the functional world, there can be all these tests, and a lot of times people can have so many unnecessary tests, right? But it's like, you guys, I 1,000% agree. Like, we need to know your gut. We need to know what's happening with your hormones. Like, those are the like foundational tests, not all this crazy testing that some people can get into and just end up spending lots of money for not much purpose. So that's really awesome.
Yeah, I'm actually glad you mentioned that, because what we see is 90+% of women, they get better and they do amazing. There is a small percentage of women, it's like you work on the gut and the nervous system and the adrenals, and you optimize the thyroid either with medications or minerals or supplements, but they're stuck. They're not getting better, or they initially get better and then they backslide. And that's when you bring out the big guns. You're like, okay, now it's time to look for tick-borne testing like Lyme disease and other things, and mycotoxins and total tox burden. Occasionally we'll have somebody who comes in, and as soon as I hear about her, I'm like, oh, she needs all of this, because it's obvious. It's like, every system is affected in the body. It's been going on for so long, or it's an acute change that is so drastic. But the majority of the time, working on your gut, your diet, your lifestyle, it's going to get you so far.
So true. And I think too, in our world now, where social media and we have so much access to all this information, it is so overwhelming for people. And they're like, they think they need to do all the things, or they don't know what they're supposed to do, or they dabble in all of these things. And it's like, let's just start with the foundation. Like, let's just start with the basics, and then let's see what we need. Because like you said, so many times it's just, we're missing the basics.
Yeah, I actually have a mentor. Her name is Sam Horn, and she calls that infobesity. Like, we just keep Googling and learning more. We listen to more podcasts. We read more books. And this is what we ask for patients when they come in. Give us 3 months. Don't do anything else. Be fully 100% in on this. If you're going to do this, like, don't dabble in some other diet, some other plan, some other supplement recommendation, because it's curated for you for a reason, and it works all together for you. So when you are a dabbler, you're never going to have results. You just aren't. We see it over and over and over. So we've kind of just hardlined it with our patients from the get-go. Like, if you're going to be all in, you got to be all in, because if you want the transformation, that's what you have to do. And we don't want you to fail. Like, it's just as frustrating for us. And so we need your buy-in on this.
100%. Amen. I love that. It's so true. You spend so much time educating and talking through things with a patient, and then they go spend 5 minutes with their primary care provider who said that everything we're doing is wrong. And then you're like, oh gosh, okay, here we go again.
Yes.
Like, we're in or we're not. Like, we got to commit for sure. I would love to know, like, is there any big patient story that stands out to you, or like any favorite, like, ahas or just incredible transformations that you've seen?
Actually, just this morning, my team and I have a group text thread. We talk and we pray and share patients. We don't ever put their names in there, but my girl, Amy, one of my providers, had mentioned she had just seen one of our patients that we had started her on ivermectin cream for her face. So this woman came to us with a diagnosis of rosacea. She is carrying some extra weight. She is tired. She's got elevated inflammation marker, CRP, and some other things. And she was feeling really frustrated because she kept getting this cycle of oral steroids for her rosacea and then some topical cream. And she was like, okay, I think I want to try something different. She started Healthy Her. And as soon as we started her gut healing protocol, her face got 10 times worse. Like hot, burning, raging red pain. And she was like, I can't do this anymore. This is terrible. I can't go out in public. It's so painful and embarrassing. And we were like, give us a couple more weeks. Things often get worse before they get better. And it's more than rosacea. And so we started her on some ivermectin topical cream because I suspected that she had some parasite and bacterial infections that had started in her gut, but are now affecting her skin microbiome. And she has been on this cream, I think, a week, and she is astounded. I cannot believe how much better it is. It's finally calming down. I can't believe I didn't need to go on the oral steroids. What a difference. And so we're just celebrating as a team, like, oh my gosh, we're finally getting a breakthrough for her, for this woman who has been stuck on oral steroids for years. Because the truth of it is, oral steroids, they mess up your adrenal glands and your sex hormones and your metabolism. Like when you're taking the
100%.
steroids, you're so hungry and you're just like ravenous, and then you're not making your own DHEA and cortisol because you're on these medications, and then it gets taken away and you can't get out of bed because you're exhausted because your adrenals aren't functioning properly, and then you gain all of this weight. And so it's like this vicious cycle this poor woman has been in, and we're finally going to break free because we're getting to the root cause of what's driving all this. So like, this is just the first couple of weeks. I can't even wait to see what happens when she gets through her gut healing regimen.
That's amazing. That's amazing. And I love, we were actually just talking about topical ivermectin yesterday in our provider meeting. So I love that. That's interesting timing that you brought that up. Give me like top 2 or 3 pieces of advice for we see a lot of perimenopause and menopause. So like top 2 or 3, like you got to know this if you're in perimenopause or menopause.
Number 1, your adrenals are your backup ovaries. So our ovaries make estrogen, progesterone, and testosterone, and they have a lifespan. That factory is going to close up shop permanently and no longer produce at the level that they did in your 20s, 30s, and 40s. And so our body has incredible innate wisdom. It's designed so intricately. God knew that when those factories closed up and you no longer ovulated every month to get pregnant, that you still needed sex hormones, just in lower amounts. And so he designed the adrenal glands to produce sex hormones as well. That is where some of your testosterone comes from, and your estrogen and your DHEA. And so when the ovaries stop producing the way that they were, we look to the adrenals to say, okay, you're front and center now, you're up to bat. But unfortunately, the majority of women in the United States are going into menopause with tanked adrenals. They have burnt those adrenals out from their crazy busy lives. We think that because we can handle stress that it's not affecting us. But I promise you, your physiology is affected. It is responding to all of that chronic stress. And I'm not even talking about just the fact that you might hate your job or, struggle with your kids in the mornings and like have a cortisol spike by the time you drop your kids off to school. There are internal stressors that if you do not deal with it, it's taxing on your adrenal glands. So if you have a gut infection, chronic yeast overgrowth in your gut, a root canal with a little stealth infection that keeps seeping into your bloodstream every day, heavy metals in your water that your body's trying to constantly remove, all of that are internal stressors, and they tax the adrenal glands. So that is why we're seeing so much symptomatic menopause than we ever have in decades past, because we live in a toxic world. Our bodies are stressed more than ever. And so our poor little adrenal glands are like, we can't even get you through this. We're done. We're exhausted. So that's a long lead up to this first number one answer is, you got to get into parasympathetic rest, digest, and repair. That is going to calm your adrenal production down and help you start to heal. And that looks like reading the word, praying, meditating, doing deep breathing techniques, doing more of healing restorative movements like Pilates instead of going to Orange Theory and HIIT classes, and really dialing in, activating that vagus nerve to calm your nervous system down, to stop all that adrenaline, all that cortisol production. That is going to take you so far in menopause. And then the other two, I'll keep it much shorter. Number two, you can't eat the way that you did in your 20s, 30s, or 40s. You have to eat differently as your body is functioning different with lower levels of hormones. Even if you're on hormone replacement therapy, you just can't eat that garbage and that processed foods. And fasting is actually one of your superpowers from God. So learning how to regain your metabolic flexibility, how to go from sugar burner to fat burner and incorporate different ways of intermittent fasting is going to take you so far, because you can work out all day long. You could have so much muscle built, but if you don't understand how to control your food, then you're just going to have a layer of fat over your muscle and you're going to be unhappy. So that is number two. And then number three, stop trying to do it without Jesus. Like, you have got to stop carrying everything yourself and thinking that you're the only one who can help your kids. You're the only one who can do this for your husband or your coworkers. You got to stop carrying stuff that God never asked you to carry, because that is not sustainable. That is a sure path to dysfunction and disease and cancer and all of the other things. So start handing some stuff over to God. Jesus says, my yoke is light. Like, he wants to carry it for you. And it's so much better. It's way better.
That's amazing. Again, goosebumps. I've had so many goosebumps this during our talk here. I also am so excited because literally these are the things that we talk about. It's how we teach our patients as well. And so now you're saying it. And so it's not just coming from me all the time. Like, yes, I love it. I'm not crazy.
So good.
Okay. So I want our audience to know, how do they follow you? Where do they find you? And tell us about your tour. So you're not the rock star on tour, but you are going on tour. And this is, I just love God's sense of humor, right? He's like, I know you really wanted this. It might not look like what you thought, but I'm giving it to you. I'm giving you the desires of your heart. So tell us about that. And I already got my tickets, VIP tickets. I'm going to be there. So
yay. I cannot wait to see you in Minnesota. Yes. I had the honor of doing a 3-part podcast series on the Candace Cameron Bure podcast last year. And we dove deep into reproductive hormones, perimenopause hormones, menopause hormones, and where conventional medicine is really failing women. And so that was really well received. Women were just like, oh my gosh, I had no idea. I can't believe all of these things that I'm learning. And so I went on and created a course for Candace Cameron's community, her Together community. That's been really well received. And her team was like, we got to bring you on her book tour. Women want to know about their bodies. They are hungry to understand what their body is saying to them and how they can actually just get healthy and focus on their kids and their lives and not be going to the doctor all the time and worrying about this stuff. So I'm still in awe. Like, you literally need to pinch me because I'm not sure that it's real, but I get to live on a tour bus with Candace for 8 cities. It's going to be an amazing whirlwind in September, and Minnesota is one of our cities. So I cannot wait to hug you in person. It's going to be an incredible night. And Candace is literally as kind and loving and sweet and fun as you would imagine that she is. She is DJ Tanner in real life. She's like your big sister. She's so sweet and fun. Oh, yeah. So it's an amazing night of just like having a good time, connecting with Jesus, learning about your body and how to have a good life. It's just a lot of fun, exciting things. So last year when she did it, she had some games. She brought people up on stage from the audience, and we had some special guests come on. So I can imagine it's going to be all kinds of surprises and a good time. So I hope you all come out, and so I can hug you all.
We need to like put something up in our clinic. I was just thinking about that, like something like a QR code or something to buy tickets for people.
Yes, so let me get that to you. That would be so good.
Yeah, that would be incredible. And again, like, isn't God just so cool? Like, he's using all these women in these places, and we seem like we're not a big deal, right? Like, God's a big deal, but it's just so cool how he uses us and orchestrates us. And it's like, we're going to be heard. We're going to get the message out there. So no stopping us.
No. And can I just share one last thing? Because
yes,
sometimes women are like, well, that's great for you. Like, God is blessing you. You're having an amazing life, but he's not going to do that for me. Or we're just not seeing it, right? And it can feel very defeating and sad and frustrating. And I just want to share with you that last year, I thought I was going to be a part of Candace's tour. They told me I was going to come on stage in Grand Rapids, Michigan, and like be a part of the show and answer questions. And the day of, I still didn't have any details about it. And when we got into the building, her main guy came up to me. He's like, we've decided to not bring you up. We just don't want to change the flow of the show. And in that moment, I was really devastated and really sad and like, okay, I guess it's not going to happen for me. And I made a decision. I was going to go and celebrate Candace and just support her and her mission and not worry about it. And just not feel sorry for myself. And then for 6 months later, them to turn around and say, you get to come on the whole tour and be on every stage. Wow. I just thought, wow, God, I'm so glad I trusted you and didn't get bitter in that moment and didn't believe that you had failed me or forsaken me. He had bigger, better plans. I just didn't know about them. But all I did was focus on the goodness that other women were doing, and I was celebrating them and showing up for them. And God sees it all. He sees all the pain in your heart, all the sadness, all the desires. And if it hasn't happened yet, especially in your health journey, it's going to. You have to trust, but you have to get into action and you have to continue to pursue. I kept in contact with Candace's team. I kept, offering support and services. I created that course and I did anything I could to just serve them and their audience. So that's what I would encourage women today is like, are you doing your part so God can do his? And just have hope.
So good. That's so good in all areas, like across all areas of life, right? Like that's, you can use that everywhere. That's so good. And like surrounding yourself with the right women too, it's
Absolutely.
the women who are going to lift you up and keep you going and pull you out of that like self-pity and be like, all right, I get it. That sucks, but let's go. Like we're going to keep going. So, and it's the same thing with health, right? Like, yeah, our patients feel terrible and you meet them there and you empathize with that, but you're not going to leave them there. Like we're not staying here. We're going to keep moving and we're going to get better. So that's so awesome. I am so excited to be there. I'm so excited to share this with our listeners and to see you again soon here in June. That's going to be amazing. But will you just end for us, just letting us know, like, how do they find you on Instagram, or like, what's the best way to kind of follow you, and any other resources that you have for them?
Yeah, absolutely. I am a Gutsy Dr. Tabatha on Instagram, Dr. Tabatha on Facebook. You can go to fasttofaith.com, drtabatha.com. We have the podcast Fast to Faith. I just interviewed you, so I'm excited to drop that this summer. It's going to be such an amazing episode. Reach out to us. We would love to connect with you and see how we can support you.
All right. Thank you so much. And I'm just praying blessings over your day and everything else that God blesses you with in the coming days as well.
Thank you.
Thanks for listening to the Flourishing Life Podcast. You can watch the full video version of this podcast inside the Spotify app or on our YouTube channel. If you liked this episode, please rate, review, and subscribe on your favorite podcast app. And we would love it if you would share this episode with a friend and follow us on socials, Instagram, TikTok, YouTube, and Facebook, or on our website at flourishmedicalwellness.com. Chat soon, everyone. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.